we'll start with this topic of cataract. My name is Dr. Wajid Khan. Right. So you might have seen these kind of patients. The picture which I am showing you over here, right? You might have seen this kind of patient in your home or in your relatives, or anyway you might have seen this kind of patients, right? So as the patient is aging, the patient develops this disease in the eye. That is called as what, guys? That is called as cataract. In Hindi, we call it as motia also. Cataract or motia, right? So this disease is called as cataract, right? So if you want to define cataract, how will you define what is this cataract? Is the cataract pathology of the sclera? No. Is the cataract pathology of the cornea? No. Is the cataract pathology of the iris? No. The cataract is the pathology of what? It's the pathology of lens. Yani ki basically what is cataract? Cataract is the opacification of the lens. Opacification of the lens or the capsule is called as cataract. The definition of cataract is what, guys? Opacification of lens or the capsule surrounding the lens is called as cataract. If that gets opacified, that is called as cataract, right? Guys, remember, cataract is the leading cause of blindness. It is the most common cause of blindness, right? So you can write there, cataract is the most common cause of blindness. It's the most common cause of blindness in India. Why? Because remember, cataract itself does not cause blindness, but they are the patients who are neglecting this cataract. Even though they are having opacification of the lens and all, they don't go to the doctor. They don't show their eyesight and all. They just live their life like that, and due to that what happens? Due to that what happens? The lens totally becomes opacified. The light rays which are focusing on the retina, they also have lost their ability to focus on the retina, and the patient might become blind. So remember, guys, the most common cause of blindness in India is what, guys? Cataract. The second most common cause of blindness in India, the second most common cause of blindness in India is glaucoma. In India is what, guys? Glaucoma, right? Next, the infective cause of blindness is trachoma. The infective cause of blindness, it is trachoma, right? Blindness associated with ocular morbidity, it is refractive errors. But again, we are discussing about what? We are discussing about cataract. What is cataract? This is the lens. Cataract is a pathology of the lens. If the lens gets opacified or the capsule of the lens get opacified, it is called as cataract. It is the most common cause of blindness in India. Okay. Now, guys, regarding cataract, what else we need to remember? We need to remember the classification. The classification of cataract. Cataract is classified based on three things. Based on where it is occurring, it is classified. Based on the location, it is classified as nuclear, cortical or posterior subcapsular cataract. Okay? Basically, we are discussing about the classification of cataract. Cataract is classified based on three things. One is the location, second is the cause of cataract, third is the maturity. Okay? So first, based on the location, what are the forms of cataract? Based on the location, there are three types of cataract. So basically, I told you guys that cataract is classified based on location, based on causes, based on the maturity. We are discussing about what? Based on location. Based on location, there are three forms of cataract. One form is called as nuclear cataract. The other is called as cortical cataract. The last is called as posterior subcapsular cataract. Okay? So if the cataract is occurring at the nucleus part of the lens. It is called as nuclear cataract. If the cataract occurs at the cortical part of the lens, and cortex, it is called as cortical cataract. Or if the cataract occurs at the posterior subcapsular part, it is called as posterior subcapsular cataract. We have to discuss what are the features that you see in nuclear cataract, what are the features that you see in cortical and posterior subcapsular cataract. Based on the location, these are the three types of cataract. Now in these three types, if someone asks you which is the cataract which is having the worst prognosis, always remember it is posterior subcapsular cataract. It is posterior subcapsular cataract. This is a cataract which is having a worse prognosis. Whereas nuclear and cortical cataract, it does not cause that much of problem. But it doesn't mean that you don't have to treat. You have to treat. But if the patient develops posterior subcapsular cataract, the treatment should be as soon as possible. Why? Because it produces maximal visual handicapness. So remember, cataract associated with the worst prognosis based on location is what, guys? It is the posterior subcapsular. So anyways, guys, I told you there is nuclear cataract, there is cortical cataract, and there is posterior subcapsular cataract. Okay? Coming to the first cataract, which is called as nuclear cataract. What are the features of nuclear cataract? Nuclear cataract, यानी the cataract which is occurring on the nucleus of the lens. Okay? So imagine, guys, this is the lens. Okay? And imagine this is the retina. This is the retina. As the cataract is occurring at the nucleus of the lens, what will happen? What will happen, guys? As the cataract is occurring at the nucleus of the lens, what will happen to the refractive index of the lens? The refractive index of the lens, which was 1.38, it increases to 1.40. It increases to 1.40. If the refractive index increases, now don't tell me, guys, the refractive index is increasing, so it is a good thing. No. If the refractive index increases due to formation of this cataract, if the refractive index increases, what will happen? Remember, guys, first I'll tell you what happens in a normal patient, then we will discuss about what happens in this patient who is suffering with nuclear cataract. So imagine a normal person is there. When a normal person is there, when he doesn't have any cataract or anything, the light rays travel from infinity and focus on the retina. This is retina, guys. This is the lens. Okay? So this happens in a normal person. If a person suffers from nuclear cataract, okay? This is the lens. Here is the nuclear cataract. Now again, this is the retina. So what happens in this patient? If the person develops nuclear cataract, his refractive index of the lens increases from 1.38 to 1.42 at the 1.38 to 1.40 at the nucleus part. So what will happen to the light rays, guys? The light rays, instead of focusing on the retina, the light rays will focus much before the retina. If the light rays are focusing much before the retina, this patient will develop what? Come on, guys. If the light rays are focusing much before the retina, this patient develops what? This patient develops myopia. This patient develops myopia. Why is the patient developing myopia? Why? Because the patient had nuclear cataract. Due to the nuclear cataract, the refractive index increased, and due to that, the light rays were focusing much before the retina. Hence, the patient develops what myopia? Index myopia. The patient develops what, guys? Index myopia. So we are still discussing about what, guys? Nuclear cataract. So in nuclear cataract, what do you see? The patient will have, as the cataract is developing on the lens, what is happening? You can write there. In nuclear cataract, the refractive index of the lens increases from 1.38, and again refractive index of the lens nucleus increases from 1.38 to 1.40, which leads to index myopia. That leads to what, guys? Index myopia. So one of the important feature of nuclear cataract is this patient who develops nuclear cataract, they will develop index myopia. Apart from index myopia, this patient will also develop hamarlopia. This patient also develops hamarlopia. What is it, hamarlopia, guys? Hamarlopia is what? Hamarlopia is day blindness. Hamarlopia is what, guys? It is day blindness, right? Hamarlopia is also called as day blindness. How is the night vision of the patient? The night vision is totally normal. The night vision is totally normal, right? So, nuclear cataract patient develops what? He develops index myopia, he develops hamarlopia, right? And some of the patient might also develop second sight phenomena. Some of the patients of nuclear cataract will also develop second sight phenomena. Right? Second sight phenomena. Now, next coming to, we'll discuss second sight phenomena later while discussing the refractive errors and all, okay? So, nuclear cataract, we need to remember what are the important features of nuclear cataract. Coming to what, guys? Cortical cataract. We'll write cortical cataract in the next page. Cortical cataract. We are still discussing cataract based on the location. Nuclear we have discussed. Now coming to cortical cataract. Cortical cataract means what, guys? Cortical cataract means this is the cataract which is developing on the cortex of the lens. On the cortex of the lens, right? If the cataract develops on the cortex of the lens, what will happen? Once again, we'll discuss, guys, what happens. As the patient is developing cataract on the cortex of the lens, what will happen now? The light rays, imagine, guys, this is the retina, right? As the patient is having cortical cataract developing on the cortex of the lens, what will happen now? The light rays now will focus behind the retina. If the light rays are focusing behind the retina, such a patient will develop, such a patient lands up into what? Such a patient lands up into an optical, a refractive error, which is called as what, guys? Hypermetropia. And any hypermetropia that is occurring due to the change in refractive index is called as what? Index hypermetropia. It is called as index hypermetropia, right? So, cortical cataract, what is happening, guys? There is a opacification which is developing on the cortex of the lens that causes index hypermetropia. Cortical cataract causes index hypermetropia. Index hypermetropia. This is the common type of cataract in adults. Based on the location, it is a common type of cataract in adults. This cortical cataract is also called as cuneiform or wedge-shaped cataract. It is also called as cuneiform or wedge-shaped cataract. Wedge-shaped cataract. Okay. So, guys, this was regarding what? This was regarding the cortical cataract. We have discussed cortical cataract. Apart from that, we have discussed the nuclear cataract. Now, coming to the next form of cataract, which is called as what? Posterior subcapsular cataract. Posterior, remember, nuclear we have discussed, cortical we have discussed. I told you the cataract which is having the worst prognosis is posterior subcapsular cataract. Why? Because this cataract is formed on the nodal point of the eye. And again, nodal point in the lens of the eye. What is the nodal point, guys? Nodal point is a point where the light rays travels in a straight line without converging or diverging, right? So, if the cataract forms on the nodal point of the eye, it leads to maximal visual handicapness. So, remember, guys, Posterior subcapsular cataract, it's a cataract that produces maximal visual handicapness. It produces cataract or it produces glare at the nodal point of the eye. What is the nodal point, guys? Nodal point is seen on the posterior capsule. What is this nodal point? It is a point where the light passes in a straight line without converging or diverging. The light passes in a straight line without having any conversion or diversion. So remember, guys, the more the posterior, the worse will be the prognosis of the patient, right? Posterior subcapsular will be having a worst prognosis, right? So these are the three things. Remember, based on the location, there are these three types of cataract. One is nuclear, other is cortical, and last is posterior subcapsular cataract. Posterior subcapsular cataract. In this posterior subcapsular, remember in these three, the one which is having the worst prognosis is posterior subcapsular cataract. Posterior subcapsular cataract. Okay. Next thing, guys. So we have discussed cataract based on the location. Now we will discuss cataract based on the causes. Based on the cause of cataract. Now, guys, in the introduction of cataract, I told you that as we are aging, we will develop this condition. We will develop or we can develop. We can develop this condition. Basically, remember, one of the cause of cataract is aging. That is called as senile cataract. Senile cataract. Not all of us will develop cataract. Some of us will develop cataract. There are some risk factors for senile cataract. So, based upon the causes, the most common type of cataract that you see is age-related or senile cataract. Apart from age-related cataract, what are the other types of cataract? Metabolic cataract. Metabolic means what? Cataract developing due to some underlying metabolic diseases of the patient, such as what? Diabetes, galactosemia, Wilson's disease. The patient develops cataract due to the underlying diseases. That is called as underlying metabolic diseases. Underlying metabolic diseases. That is called as what, guys? That is called as metabolic cataract. So, based upon the causes, there is senile cataract, there is metabolic cataract. Apart from senile and metabolic, what are the other forms? Traumatic cataract is there. Cataract developing due to trauma, right? There is congenital or developmental cataract. Apart from congenital or development, there is radiation-induced cataract, there is drug-induced cataract, right? There is radiation-induced and drug-induced cataract and heat-induced cataract. So, guys, remember, based upon the causes, these are the types of cataract. Based upon the location, we know cortical, that leads to nyctalopia. Did I tell you nyctalopia? No. Okay. Cortical cataract. Okay. What is nyctalopia? First of all, guys, nyctalopia is night blindness. Hamarlopia is day blindness. So, cortical, if you just remember the nuclear cataract, cortical is total opposite of nuclear cataract. Okay? So, cortical cataract produces nyctalopia. What is nyctalopia, guys? It is night blindness. It is night blindness. Okay? So, we have discussed the based upon the causes, based upon the location we have discussed. Based upon the causes, the first and the most important and the most common cause is what, guys? Senile cataract and the age-related cataract. So, I told you guys, not all of us, some of us will develop cataract. What is the cause of us developing cataract? Not all of us, only some. The reason is what? Some risk factors. What risk factors, sir? Usually, I used to remember like this. I used to remember like, if I become an ophthalmologist, I'll be sitting in my OP, and in my OP, I'll be getting most patients of cataract. And the most common cause of cataract is age-related. So, I used to remember, I will get a patient whose age will be 60 years old, right? 60 years old lady. Basically, a 60-year-old lady comes to me with a complaint of cataract, right? When I take the history of her, she's telling that, doctor, I have been exposed to dust, I have been a smoker, I have been exposed to the ultraviolet rays. She's basically a laborer who used to work in the dust, who used to smoke, and who used to be exposed to the ultraviolet rays. So 70-year-old lady. So when she is a laborer, when I'll ask her, did you have any, like, did you study anything and all? Like, I'll check her literacy. She'll be telling that, doctor, I'm an illiterate, I did not study anything. Apart from that, she'll also have a history of early marriages. So risk factors for developing cataract, these are the risk factors which I told you. A 70-year-old lady who is a laborer, when you ask her, or 60-year-old lady who is a laborer, when you ask her risk factor, she'll be telling what? She is basically a laborer who was exposed to the ultraviolet rays, working in the dusty environment, who is a smoker, having a history of early marriage, okay, and illiteracy. So these are the risk factors for developing what cataract, guys? Senile cataract. Senile cataract. It has been basically all senile cataract patients, when they were screened, these risk factors came out, that these risk factors can lead to this age-related or senile cataract. So once again, guys, age-related or senile cataract, what are the risk factors that we need to remember? We are discussing basically, remember, based upon the cause, there is senile cataract, congenital cataract, traumatic, metabolic, complicated, heat-induced, radiation-induced, drug-induced. We are discussing about the first, which is called as what, guys? Senile cataract. For senile cataract, what I told you, what we need to remember for senile cataract, we need to remember the risk factors. Risk factors. What are the risk factors of senile cataract? Age. Age more than 50 years. Apart from age more than 50 years, what are the other risk factors? Come on. Try to recollect that lady. Exposure to UV rays, especially the B component of the UV rays. Especially the B component. Apart from that, exposure to dust, then smoker, then early marriage and illiteracy. Early marriage and illiteracy. Illiteracy, right? So these are the risk factors for developing what cataract, guys? These are the risk factors for developing senile cataract. Senile cataract. If a person is wearing sunglasses and all, that will reduce the incidence of cataract. But these are the risk factors. So usually 70% of the cataract OP patients will be having women of more than 50 years, having work history of dust, heat, low level of education and history of early marriage, right? Hypertension is not a risk factor. These are the risk factors. The risk factors of cataract are very, very important. So remember that 70-year-old, 60-year-old lady, you will remember all the risk factors, okay? Now guys, that was senile cataract. That was senile cataract. Coming to the next cataract, which is called as what? Congenital or developmental cataract. What is meant by congenital cataract? Congenital means what, guys? By birth, the patient is being diagnosed. By birth, the child is being diagnosed with cataract. Developmental meaning what? After 1 year, after birth, after 1 year, the child develops cataract. So guys, my question to you is, which cataract will have a worse prognosis? Congenital or developmental? Which will have the worst prognosis? Which one, guys? The answer is congenital cataract has the worst prognosis. Now the question should be, why, sir? Why is congenital cataract having the worst prognosis when compared to developmental? Okay? Why? Why? Because remember, congenital means what, guys? Congenital means by birth the patient is having an opaque lens. By birth the patient is having an opaque lens. If the patient has an opaque lens by birth, okay? Now, before going towards the right answer, first of all, guys, tell me, when the child is born, will he focus on the lights or will he focus on the things properly? When you tell, when you do and when you make any expressions also, he is not able to, he won't be like in the first 3 or 4 months, he won't react also. Why? Because he's not able to see the light rays. When the child is born, the light rays will focus where? The light rays will focus much behind the retina. That's why most of the childs are hypermetropic. They are not able to focus, the light rays are not able to focus on the retina. It takes 2 to 4 months of age for the light rays to develop this habit or develop the ability to focus on the retina or on the fovea. That is called as foveal fixation. How many months, guys? 2 to 4 months of age, the child develops foveal fixation. Okay? And once he becomes 6 months of age, he develops the habit of accommodation. You know what is accommodation? Accommodation is the process of, I told you that in our eye, what is the thing that undergoes accommodation? The ciliary muscles, and basically ciliary muscles help the lens to undergo accommodation. Right? Guys, remember, we are discussing about what? We are discussing about which cataract is having worse prognosis. So guys, remember, a normal child is born, he develops foveal fixation at 4 months, he develops accommodation at 6 months. After developing all these habits, after 1 year, if he develops cataract, there is no problem. Already he have learned the habit of foveal fixation and accommodation. His vision will be not that much lost. But if he develops a congenital cataract, yani ke by birth he is having an opaque lens like this, will he develop foveal fixation? No. Will he develop the habit of accommodation? No. And if you don't treat congenital cataract as early as possible, the child will develop amblyopia or lazy eye that can lead to blindness as soon as possible also. So remember guys, congenital cataract patients are having worse prognosis, right, when compared to what? Developmental cataract. Now, why does the child have congenital cataract? By birth, from the mother's womb, why is he developing this? Remember, there could be 2 causes for developing this. Either it could be what? Sometimes the mother might be suffering with vitamin D deficiency that can lead to congenital cataract. Or sometimes the mother might be suffering with rubella infection. If the mother suffers from rubella infection during pregnancy, then there are many chances. I'm not saying that all rubella infection mothers will develop I'm not saying that all babies of rubella infection mother will develop cataract. But most of the mothers who are suffering with rubella infection during pregnancy, their child might develop what? Their child might develop cataract. Their child might develop what, guys? Cataract. That is called as rubellar cataract. So anyways guys, we are discussing about what? Congenital cataract causes. Either it is seen due to vitamin D deficiency or either it is seen due to what, guys? Rubella infection. Due to these 2 causes, we have divided the congenital cataract into further 2 categories. One category of congenital cataract is called as zonular cataract. Other category is called as rubellar cataract. Zonular cataract means what? A specific zone is opacified. This zonular cataract, what is the common cause of developing zonular cataract? The common cause to develop zonular cataract is what, guys? It is seen in mothers having vitamin D deficiency. Expecting mothers suffering with vitamin D deficiency. Any expecting mother who is suffering with vitamin D deficiency, they will develop what, guys? They will develop this zonular cataract. Right? This zonular cataract, other name is also called as Rider's cataract. Okay. So first we will complete this. My question to you was, which cataract is having worse prognosis? So the answer is what, guys? Congenital. Basically, remember guys, we are still discussing cataract classification based on the causes. The first cause was senile cataract. The second is congenital or developmental cataract. In this congenital or developmental, which is having the worst prognosis? Congenital. Why congenital? Why? Because here cataract is developing before foveal fixation. Right? So congenital cataract, the cataract develops between 0 to 1 year. The patient will present with poor vision. Whereas developmental cataract, it usually occurs after 1 year, and when compared to congenital, the patient's vision is a bit good over here. It doesn't mean that he is having a very good vision. When compared to congenital, he is having a good vision. Okay. Why congenital cataract is having a poor vision? Why worse prognosis? Why? Because the reason is what, guys? Foveal fixation. Yani कि cataract is occurring before development of foveal fixation. For usually foveal fixation occurs 2 to 4 months of age. Foveal fixation, it occurs at 2 to 4 months of age, and accommodation occurs at 6 months of age. Why the patient is having poor vision over here? Why? Because the cataract is developing before foveal fixation. In congenital, the cataract develops before foveal fixation. The cataract develops before foveal fixation. Hence, congenital cataract patients will have a poor vision. Whereas developmental cataract, guys, when we compare developmental cataract, the vision is good. Why? Because the kid has already developed a good vision, as he has already learned how to do a foveal fixation as well as accommodation, right? Then I told you congenital cataract congenital cataract is further divided into 2 types. One is called as zonular cataract or lamellar, other is called as rubellar cataract. This zonular cataract is also called as rider's cataract. It is seen commonly in expecting mothers suffering with vitamin D deficiency. Whereas rubellar cataract is commonly seen in the mothers suffering with rubella infection. If the mother is suffering with rubella infection, there are many chances the child might develop cataract. But with cataract, the child will also have some other ophthalmic features. What are the other ophthalmic features in the child when the mother is suffering with rubella infection? The other ophthalmic features that you see in the child is GSMC. GSMC. What is this GSMC, guys? GSMC means what? G stands for glaucoma. And again, if the mother is suffering with rubella infection, the child might also develop glaucoma. The child might develop some retinal changes, which is called as salt and pepper retinopathy. Salt and pepper retinopathy. The child might develop microphthalmus. Microphthalmus, yani ke small eyes. And the child might develop cataract. What is that cataract? Called as rubellar cataract. So other features that you see in, if the mother is suffering with rubella syndrome, if the mother is suffering with rubella infection, the child might have this many ophthalmic features. What ophthalmic features, guys? Glaucoma could be seen, salt and pepper retinopathy could be seen, microphthalmus could be seen, and cataract could be seen. These are the features of what? These are the features of rubella. Okay? Rubella, congenital rubella. Okay? So now, guys, this was regarding congenital. Congenital cataract is further divided into zonular and rubellar cataract. Now coming to the next, developmental cataract. Developmental meaning what? The child develops cataract after 1 year of age. Yani कि now his age is 1 year. Now he is developing cataract. So how will be his vision? His vision will be good. But why is he developing it? Not all kids develop it. Only the child suffering with what syndrome? Down syndrome develops developmental cataract. The child suffering with what syndrome, guys? Down syndrome develops developmental cataract. Right? What are the features that you see in this child who is suffering with Down syndrome? 3 features are seen. Remember, guys, if the patient is suffering, if the child is suffering with Down syndrome, he will have 3 ophthalmological features. Right? What features you will see, guys? One is the developmental cataract, which is called as blue dot cataract. Very, very important, guys. Blue dot cataract. Apart from blue dot cataract, what else you will see over here? You will see the child's cornea is conical. It's very much curved and it becomes conical, which is called as what, guys? Conical cornea is called as keratoconus. It is called as what, guys? Conical cornea is called as keratoconus. And apart from that, what else you will see? You will see brush field spots. You will see brush field spots on the iris. Brush field spots. 3 features that you see in this Down syndrome patient is what, guys? Blue dot cataract, very, very important MCQ, guys. Blue dot cataract. Apart from that, the child will have keratoconus and also brush field spots, right? This is regarding what, guys? This is regarding the developmental cataract, right? So once again, guys, based on the causes, we have discussed 2 forms already. We have discussed the senile cataract. We have discussed the congenital and developmental cataract. Now, based upon the causes, the third is traumatic cataract. Based upon the causes, the third one is traumatic. Traumatic means cataract developing after trauma is called as traumatic cataract. Now, guys, remember, initially what happens if there is any trauma to the eye, initially what happens, and if you don't treat that, then what will happen? Okay, so guys, remember, if there is a trauma to the eye, what happens is, due to the trauma, what will happen? The iris, as there is a trauma to the eye, due to the trauma, the iris goes and it sticks to the lens and then it comes back to its normal position. As the iris is going and sticking to the lens and coming back to its normal position, what is iris leaving behind on the lens? As you guys know, iris is a highly pigmented structure. What will it leave on the lens? It leaves a pigment on the lens. It leaves a pigment on the lens. That pigmentation on the lens is not a cataract. That pigmentation developing on the lens is called as Vossius ring. It's called as Vossius ring. It's not a cataract. If you don't manage Vossius ring, if the patient just manages like his vision with Vossius ring, then it might develop into what? That it might develop into a rose type of appearance on the lens. That is called as what, guys? Rosette cataract. That is called as rosette cataract. So once again, guys, we are talking about what? Traumatic cataract. Traumatic cataract is cataract developing after a trauma. But I told you initially what happens. Initially after the trauma, there is imprintation of the pupil. Pupil is what, guys? What is pupil? The space between the upper iris and the lower iris is called as pupil, right? The imprintation of the pupil on the anterior capsule of the lens is called as Vossius ring. That is called as Vossius ring. Remember, guys, is Vossius ring a cataract? No, sir. Vossius ring is not a cataract. Vossius ring is just the deposition of the pigment of the iris on the anterior capsule of the lens. If you don't manage it, then it leads to what? Then it leads to rosette cataract. Rosette usually forms on the cortex of the lens. Hence, rosette cataract is a form of cortical cataract which looks like a rose, which is seen due to severe trauma, right? So remember, guys, this is regarding what? Traumatic cataract. In traumatic cataract, you might see 2 things. There is Vossius ring initially developing, and then there is rosette cataract. Then you might see what, guys? Rosette cataract. Rosette cataract is a form of cortical cataract which is occurring on the cortex of the lens. That was regarding what, guys? That was regarding the traumatic cataract. So basically we have discussed, based on the causes, we have discussed the senile cataract, we have discussed the congenital or developmental cataract, we have also discussed the traumatic cataract. Now we'll discuss about what, guys? Now we'll discuss about the next cataract, which is called as what? Complicated cataract. Complicated cataract. Complicated cataract meaning what? Complicated cataract meaning this is cataract which is occurring due to a complication of, it is occurring as a complication of some underlying disease. Underlying disease. What underlying disease can cause complicated cataract? There are many underlying diseases that can cause complicated cataract. Complicated cataract. So, complicated cataract meaning what, guys? We'll start from here. Complicated cataract meaning what? Cataract which is occurring as a complication of some other ocular disease. Ocular disease means what? Patient was having inflammation of the uvea that has developed opacification of the lens, that are lead to opacification of the lens. That is called as what? Complicated cataract. Yani uveitis can cause complicated cataract. Remember, complicated cataract is a cataract which is seen due to the complication, due to the complication of some other ocular diseases. Okay? Such as what diseases, guys? Complicated cataract can be seen due to uveitis. Sometimes glaucoma can cause cataract. Sometimes high myopia can cause cataract. And sometimes retinitis pigmentosa can also cause cataract. Retinitis pigmentosa can also cause cataract. So, complicated cataract meaning what, guys? Cataract which is occurring due to a complication of some other ocular disease such as uveitis, glaucoma, high myopia and retinitis pigmentosa. This complicated cataract commonly occurs at the posterior subcapsular part. It occurs at the posterior subcapsular part. The traumatic cataract was occurring on the cortical part. Complicated occurs at the posterior subcapsular part. If it is occurring at the posterior subcapsular, how will be the prognosis, guys? Come on, prognosis will be bad only. Posterior subcapsular is having a bad prognosis. But the most important thing in complicated cataract is, what do you see in complicated cataract? When a patient of complicated cataract comes to your hospital, you go for an investigation called a slit lamp. You go for an investigation called a slit lamp examination. You make the patient sit in front of the slit lamp examination. You examine the patient's eye. What will you see if he is having complicated cataract? It will be different from other forms of cataract. You will see some breadcrumb appearance on the lens. Or you might also see multiple colors. Multiple colors means polychromatic cluster. You will see a cluster of colors on the lens. Okay? So remember, complicated cataract is characterized by appearance of two things. One is the breadcrumb appearance and other is polychromatic clusters. Okay? These two things could be seen in what cataract, guys? Complicated cataract. Right? So we have discussed, based upon the causes, we have discussed the senile, we have discussed the congenital development, we have discussed the traumatic cataract, we have also discussed the complicated cataract. Now coming to what? Metabolic. Metabolic meaning what? Cataract developing due to some underlying metabolic disorder. Metabolic. I'm not talking about the disorder of the eye. Cataract developing due to the disorder of the eye, that is complicated cataract. We are talking about what? Metabolic. Metabolic disorders means what? That could be diabetes mellitus, that could be Wilson's disease, there are many, galactosemia, there are many metabolic disorders. So cataract which is developing due to some underlying metabolic disorder, that is called as metabolic cataract, right? Such as examples of the disorders that can lead to metabolic cataract are diabetes mellitus, non-insulin dependent diabetes mellitus. The patient will develop cataract, but they won't be asking you the diseases that are causing. They will be asking you, in diabetes mellitus, what is the form of cataract that you see in the patient's eye? The form of cataract that you see in diabetes mellitus is what, guys? It is called as snowflake cataract. Very, very important. Snowflake cataract, right? Snowflake cataract. This snowflake is seen due to accumulation of sorbitol. And the enzyme responsible for development of this cataract is NADPH and aldolase. So once again, guys, we are discussing about what? We are discussing about metabolic. Metabolic cataract means what? Metabolic cataract means patient developing cataract due to some underlying metabolic diseases. It could be diabetes mellitus. In diabetes mellitus, you will see a snowflake appearance of the cataract, which is seen due to accumulation of what? Due to accumulation of sorbitol. And the enzyme responsible is NADPH and aldolase. That is one disease. That is one metabolic disease that can lead to cataract. Other metabolic diseases that can lead to cataract is Wilson's disease. Wilson's disease. In Wilson's disease, you will see what shape of cataract? You will see a sunflower cataract. Very, very important, guys. You will see a sunflower cataract. In diabetes, you saw snowflake appearance. In Wilson's disease, you are seeing a sunflower cataract. Other features apart from Wilson's, remember guys, other features, remember what is Wilson's disease? Wilson's disease means what, guys? Copper is getting deposited inside the body. If the copper gets deposited on the lens, it will lead to cataract. What cataract? Sunflower cataract. Apart from sunflower cataract, what else you see in the Wilson's disease? You will see some rings developing, which is called as what? KF rings, Kaiser-Fleischer ring. This is called as what, guys? Kaiser-Fleischer ring. Kaiser-Fleischer ring. That is seen in what disease? Wilson's disease. Wilson's disease. Next is what, guys? If the person, remember we are discussing still the metabolic. In metabolic there is diabetes, snowflake cataract. Wilson's disease, there is sunflower cataract. The third form of cataract in metabolic is the cataract developing due to a disorder called as myotonic dystrophy. Myotonic dystrophy. The patient who is suffering with myotonic dystrophy will have what kind of cataract? He will have a Christmas tree cataract. It is called as what cataract, guys? Christmas tree cataract. Christmas tree cataract. Coming to the last metabolic disorder, which is called as galactosemia. Any patient developing cataract due to the disease called as galactosemia will have oil drop appearance. So it is called as oil drop cataract. Galactosemia patient will have what cataract, guys? Oil drop cataract. Oil drop cataract. So once again, we are talking about what? We are talking about the causes of cataract. We have discussed the senile, we have discussed the congenital developmental, we have discussed the traumatic cause, we have discussed the complicated cause, we have discussed the metabolic cause. We have discussed the metabolic cause. In metabolic, we have I have already told you, diabetes leads to what cataract? Snowflake cataract. Whereas Wilson's disease leads to sunflower cataract. Whereas myotonic dystrophy leads to Christmas tree cataract. And last is galactosemia that leads to oil droplet cataract. Okay? Next, after metabolic, next is heat-induced cataract. Heat-induced cataract means this type of cataract is seen in the patient. Remember, this is the oil drop appearance and all. Heat-induced cataract means what? This type of cataract is seen in the patients who are exposed to a high amount of heat and all. Who are the persons who are exposed to high amount of heat and all? The workers who are working in glass industry. So basically remember, heat cataract is seen in what patients? In glass blowers, in iron workers, glass blower worker, iron worker or steel worker, steel industry. These persons will be exposed to high amount of heat. So heat-induced cataract can occur in the persons who are working in glass industry, iron industry or steel industry. That is called as heat-induced cataract. Next is radiation-induced. Radiation-induced means what? A person exposed to radiation can cause cataract. What radiation, guys? There are two kinds of radiation. One is called as an ionizing radiation, other is called as non-ionizing radiation. X-ray is an ionizing radiation. That's why I have seen many of the X-ray technicians developing cataract at a very early age. Whereas I haven't seen any MRI technician developing cataract. Why? Because MRI is a non-ionizing radiation. So remember guys, radiation-induced cataract means the workers who are exposed to ionizing radiation. The workers who are exposed to what, guys? Ionizing radiation. Most commonly we see in what? X-ray technicians. X-ray technician, right? Sometimes mobile radiations can also cause cataract. That's why guys, stay away from the mobile, right? Mobile radiation can also cause cataract. Microwave radiation can also cause cataract. These are all ionizing radiation. But non-ionizing radiation does not cause cataract. Non-ionizing, remember, ionizing radiation causes cataract. Non-ionizing radiation doesn't cause cataract. Doesn't cause cataract. Such as, example of non-ionizing, MRI. MRI. It's a non-ionizing radiation. It does not cause cataract, right? Again guys, radiation cataract also commonly occurs at the posterior subcapsular part. It occurs at the posterior subcapsular. Hence, it is also having a worst prognosis, right? So, this is regarding the radiation cataract. Radiation. Remember guys, we are discussing the cataract based upon the causes. Based upon the causes, but they can occur at any location. Radiation induced occurs in the posterior subcapsular. Traumatic occurs in the posterior subcapsular. Drug induced occurs in the posterior subcapsular. Complicated occurs in the posterior subcapsular cataract. Okay, not traumatic. Traumatic occurs in the cortical part, but most of the cataract they are occurring in the posterior subcapsular. Okay, next is the drug-induced cataract. Drug-induced cataract meaning what? Exposure to some drugs can cause cataract. What drugs, guys? What drugs? Especially the most commonly used drug that can cause cataract is what? Steroids. Steroids. But guys, remember, steroids, if I take steroids today, I won't be developing cataract tomorrow. If I take steroids for 1 month, I won't be developing cataract. Steroids taken in a very high dose can cause cataract. When will you take steroid in a very high dose, guys? When do you give steroid in a very high dose? When you don't want any complicated or any lethal reaction to occur. Normally, imagine a person is there who is being posted for renal transplantation or any organ transplantation. After any organ transplantation, you are expecting the patient to develop any graft versus host disease, GVHD, graft versus host disease. But in order to prevent that reaction, we give a high doses of steroid. That high doses of steroids given to a person for a long time, that can cause steroid-induced cataract. Steroid-induced cataract. So, steroid is the most common cause of cataract. Okay? But apart from steroid, there are other drugs also that can cause cataract. Chlorpromazine, chloroquine, busulfan, ecothiopate. Okay? These are the drugs that can also cause cataract. Okay? So, drug-induced cataract, the most commonly, drug-induced cataract, the most common drug that causes cataract is steroid. Is what, guys? Steroid. The most common drug that causes cataract is what, guys? Steroid. Steroid. Okay? And that too, high doses of steroid. High doses of steroid given after organ transplantation. Organ transplantation. That can cause cataract. That can cause cataract. Right? These drug-induced cataract also occurs in the posterior subcapsular part. Posterior subcapsular part. So, what are the other drugs apart from that that can cause cataract? Chlorpromazine, chloroquine, busulfan, ecothiopate, penicillamine, isoniazid, amiodarone. All will cause posterior subcapsular except amiodarone. Amiodarone is what, guys? Amiodarone is an antiarrhythmic drug. It can cause anterior subcapsular cataract. Anterior subcapsular cataract. Rest all of the drugs will cause posterior subcapsular cataract. Posterior subcapsular. So remember, guys, this was the cataract based upon the causes. So once again, guys, based upon the causes, what are the types of cataract? Senile cataract, congenital or developmental cataract, senile cataract, congenital developmental cataract, traumatic cataract. After traumatic cataract, what is the next thing? There is complicated cataract. After complicated, there is metabolic cataract. After metabolic, there is heat-induced cataract. Then there is radiation-induced cataract. Then last is what, guys? Drug-induced cataract. The most common and the most important drug is what, guys? Steroid. Okay. So this was the cataract based upon the causes.